When we don't get enough sleep, our brain registers that as a stressor. When our brain registers a stressor, it triggers the stress response, the HPA axis. When we are in fight or flight, when that HPA axis is triggered, even a little bit, it borrows, steals, whatever word you want to use, blood sugar and energy away from the prefrontal cortex, where we do a lot of our higher order thinking, where our brain can override the amygdala and say, you know what, Bubba, this really isn't that big of a problem right now. When our prefrontal cortex is offline, then we're using emotion-based reasoning, essentially. Now, it's all a matter of degree. A little bit of sleep loss, we're going to be a little bit foggy. A lot of bit of sleep loss, you're probably going to be in a pretty significant haze. But when we are sleep deprived, we're in that fight or flight space, at least somewhat, which means we're going to be more attentive to threats in the environment. And we're going to tend, through the emotional salience hypothesis, we're going to tend to perceive things as more threatening. This is true whether we're stressed because of anxiety or we're stressed because of sleep loss. We know that when we're stressed, neutral situations often feel more threatening. Sleep loss impairs the brain's ability to regulate emotions. That's kind of important. But again, in order to regulate our emotions, we have the amygdala, that is our more primitive area, if you will. That's where fear and all those emotions are stored. We have our hippocampus that helps try to contextualize what we're feeling and our sensory input. And then we have the prefrontal cortex, which is sort of the boss, which can override based on facts and context. But when we're not able to override the amygdala and the hippocampus with facts and context, you can get a couple of nervous Nellies that are just running off wild. The hippocampus and amygdala can get into a rhythm, if you will. So it becomes more difficult to regulate our emotions because we're not objectively analyzing what's going on. It disrupts stress hormones and immune function. Something else we've talked about a lot. When we're under chronic stress, and that includes chronic stress from sleep deprivation, eventually the body starts adapting. Cortisol becomes less effective. We start seeing downstream inflammation. We see changes in the gut microbiome, and we see changes in the immune system, which all lead to increased systemic and neuroinflammation, all of which are associated with, guess what? Mood, cognitive, and behavioral disorders. Lack